Okay, we are live. Today we have Dr. Robert Johnson with us. Today is March 27th, 2016, and Dr. Johnson has been kind enough to give us his evening. It's Sunday evening, close to 9 p.m. Pacific time. Dr. Johnson is in Salmon Arm, and he's been a practicing dentist for 7 years. Robert, is
Just
it?
about
About
seven
seven
years
years?
here.
Okay.
And
He practices bioblock orthotropics. He has taken Bill Hang's course. What was his name of his course?
it's called a mini residency. So
Okay.
it's 4 sessions, September,
Okay.
November, March, and June. So
Okay.
4 sessions over 9 months.
Okay. Um, so so Rob, you have this understanding of the connection between sleep apnea and orthodontists and orthodontic work, or a certain type of orthodontic work, and you've had your own personal experience with this as well.
Correct, yeah.
Okay. Tell us about that.
Yeah, well, basically, like we said, I've been a dentist for roughly 7 years now, and for the first three of those, I was gonna quit because it was too depressing for me. Like, we see all these patients with a whole bunch of problems, and I don't have any solutions, right? Um, I figured out pretty early on in dental school that it was almost impossible to learn anything there. And so I kind of was working on figuring it out myself. So I read a bunch of textbooks and I went and hung out with some specialists and just observed and asked questions. And then still, when I got into the real world, like I said, I very soon realized I still didn't know anything about anything. And so I was trying to figure it out myself. And then one day I kind of had this epiphany because I had seen something online about posture. And it talked about the fact that if you have good posture, you can stand with your heels, your butt, your shoulders, and your head touching a wall. And I've always had horrible forward head posture. And so I went and stood against the wall, and my head was super far away. And when I tried to shove it back against the wall, I couldn't even physically do it. But as I was trying to, I noticed that my lower jaw wanted to jut forward. I couldn't close into my normal bite, right? And so I started cursing my orthodontist and saying, like, what idiot would set somebody up so that the only way your teeth fit together is if your head is super far forward. And about a week later, a classmate of my wife's from dental school, told me about this course he was going to go take in LA with Bill Hang on bioblock orthotropics. And he kind of told me a bit about it. And the course is in like 2 weeks. Like this is August that he's telling me this, and the course is the first weekend of September. So I Googled it. I spent a bunch of time on Bill Hang's website. I actually phoned and talked to Debbie, his wife, for probably 2 hours. Um, because at that point I had done a whole bunch of CE, right? I'd gone to all these different courses. I spent a bunch of money, and one of two things happened. Either I didn't really learn anything because I'd already read all those textbooks and gone and hung out with all those specialists, or I learned some really cool stuff, but it was a little bit hard to actually apply it in salmon arm and get people to pay for it and be able, it's not a large market here. So, I had to make sure I could justify because it was a decent commitment to take this course, right? It's 4 weekends in LA. So yeah, so I spent a bunch of time on that. And then, so I ended up going because, like I said, I was about to quit dentistry. So I figured I've got to take this course or I'm out. And, it just completely blew me away. Like the very first day was, I call it a 9 hour lecture on how orthodontists are ruining people's faces and lives and causing TMJ problems and sleep apnea and killing people. And it was so obvious to me because I am a victim of conventional orthodontics, right? I had two upper bicuspids extracted and everything pulled back. And so I've got no chin and a giant nose and no airway. So I have forward head posture.
Could we stop for a sec?
Sure.
So, for parents watching, can you kind of explain, like, in like step by step, and go through the mini steps of how retracting teeth back and pulling the bones back um, causes a diminished airway and a forward head posture, and what is head posture? Because these people are wondering what is forward head posture and
Sure.
what is the danger of it too.
Sure.
So let's start with the step by step, just like the micro steps, like almost like a stop motion animation.
Okay. Well, so I guess so. What happens is you look at a kid like me. Okay, so I'm whatever age I am, 10, 11, 12 years old, and I have buck teeth, right? So um, lay people talk about having overbite. So someone has buck teeth. They say, "Oh, I had this overbite." Technically, overbite is the vertical overlap. The horizontal relationship is called overjet. So you can have overjet and overbite, or overbite without overjet, or whatever, right? You can have there's basically four combinations of that, I guess. You can have an open bite. Um, but so what happens is you're me, you've got this overjet problem, and so orthodontists are going to tell you you've got two options. You can have jaw surgery to move your lower jaw forward, or we can pull out some of your teeth and camouflage this problem by bringing these ones back, right? Because this is insane, but all they're trying to do is get your teeth to fit together the way they think they're supposed to, which is, I don't know what that's based on. And so, because it turns out when you've got this issue where your upper teeth are ahead of your lower teeth, um, that's a skeletal problem, right? So, what's the problem? Is your upper jaw too far forward? Is your lower jaw too far back? Is it a combination of both? Turns out that's actually a trick question because they're both too far back to begin with, right? I know Bill talked about in his video McNamara did this study back in the early 80s where he said, when you've got this, they call it a class two relationship, this upper jaw is almost never too far forward. In fact, it's usually too far back. And that's by his standard, which is wrong anyways. If you look at John Mew's um, Paleolithic norm, it's always too far back, right? 100% of the time. So what ends up happening is you're going to have this relationship here. You're going to pull out some of your teeth. You're going to pull these back. You're going to get to here where you don't have any overjet anymore, but you still have space. Like the tooth they took out, there's still some space there, which is illegal according to orthodontists. So they have to keep retracting it even more. So they drive the upper teeth down and back, and they push the lower jaw down and back. And then you end up with airway issues because your tongue is supposed to live in your mouth. And if you don't have room for it in there anymore, it's down in your throat. So if you look at a CT scan of somebody like me, my airway is literally 3 or 4 millimeters wide. And I don't know what it's supposed to be, but it's probably closer to 15 or 20 at least. Like I think they call the norm 10 to 12, but you got to understand what a norm is, right? So the ideal, or the way it's supposed to be, is actually much larger than that. So to compensate for that problem, you end up moving your head forward and tipping it back like this to open your airway, because that's now the only way that you can breathe, right?
Mm-hmm.
And breathing, it turns out, is your most primal urge. I heard somebody use that expression at a course I was at in Chicago, because you can go, several weeks, I think, without food, a few days without water, but 5 or 10 minutes without oxygen, you have permanent brain damage, right? So that's breathing is your most primal urge. So you're going to do whatever is necessary to breathe to keep yourself alive, even if that means completely screwing up your musculoskeletal system and causing yourself a whole bunch of other chronic issues and chronic pain, right?
For the rest of your life.
Yeah, oh yeah. And it only gets worse over time. That's the insane thing, right? Like again, you're me. When I finished my orthodontic treatment, I was only about 5'6" tall. Like I wasn't even through puberty. So I'm 6'4" today, right? So I mean, I had a tremendous amount of growth ahead of me still, so what happens with orthodontists is you're not going to see an orthodontist anyways unless your growth is already screwed up, right? Like you don't have crooked teeth unless you've got some kind of a problem. But the thing is, you go to an orthodontist, they make you worse instead of making you better. So they take this kid that's already going bad and make you worse, and then you carry on that trajectory for the rest of your life. So how do you think that's going to turn out?
So for parents watching, like some of them are going to want to know what's the consequence for my kid if my kid has a compromised airway, if my kid has forward head posture, what are some tangible consequences that this kid is going to face throughout their childhood, their adolescence, and their adult life?
Well, I don't know. From my experience, that's all I can speak to is the number one issue that I always had was I was exhausted. Like, as long as I can remember, right? My entire young adulthood and early adulthood and all through university. And, um, I did, there's confounding factors, right? I mean, I used to work at a golf course and so I had to be up very early. And so there was a couple years there where I didn't get enough sleep. So I figured, I heard somebody talking about this sleep debt idea, but I think it's just, yeah, I mean, quality and quantity of sleep is extremely important, right? And so if you've got sleep apnea or some kind of upper airway resistance syndrome precursor to sleep apnea, that messes up your entire physiology, right? I mean, you've got high blood pressure. Um, I don't even, like I said, how it manifests is going to depend on the different people. Um, and I think it makes a big difference whether you're male or female. I was at a course in Chicago again where this one presenter went through this whole thing about, what happens. And, you start out with high blood pressure and then you get put on medication, of course. And then you have kidney problems and you put on medication. And then you got liver problems and you put on medication. Went through this whole thing and he said, now you're basically a walking pharmacy. And he'd filled up basically the entire slide. And then in the upper left-hand corner was still open. And then he said, now women, they're a different species from a different planet. You're not allowed to diagnose them with sleep apnea because that's illegal. So they instead get diagnosed with depression and anxiety and fibromyalgia and chronic fatigue and chronic pain and those different types of symptoms, right?
Why can't women be diagnosed with sleep apnea?
He was just joking. He was just being facetious. But it's just, like I said, there seems to be some differences. Men tend to develop high blood pressure and have heart attacks and strokes and things like that.
Right.
Women, it seems like they've got more TMJ issues and pain issues and depression and anxiety and
Got
stuff like
it.
that.
No, I got it was a joke. I was just didn't quite get it. So
So that's kind of the, like I said, it's going to depend on, I mean, personally for me, I do have some back pain
yeah,
problem, but I'm relatively okay. Like I'm functioning. I'm not, I know there are people that, again, it gets complicated because by the time people, as you're aging, there's a lot of people that, they've got all these problems, but they blame it on their whiplash from their car accidents and there's other traumas and things like that that happen to people. So it kind of muddies the waters and it's not a clear
okay.
picture all the time. But
But so a kid who's had their upper jaw retracted now has a diminished airway, so they're tilting their head forward, leaning it forward in order to keep the airway to prop the airway open. That's how they breathe. And so now, because the head is not directly on the spine, it's
mhm.
the weight isn't totally perpendicular. It's the head's on an angle. That's going to create back pain.
Oh yeah, for sure. I mean, that's the thing. Your head's connected to your body, right? And there's another thing that kind of goes hand in hand with what we're talking about, which is there's a really incredible book called Eight Steps to a Pain-Free Back by a woman named Esther Gokley, and that's more the overall body posture picture, right? Like, how is a human being supposed to sit and stand and walk and bend over and lie down, right? Because it's all connected. So you can't just separate your head from your body and your teeth from your head, right? Like that's the crazy thing about orthodontists. Like I said before, I mean they've got all these goofy ways to try to fix your teeth when they don't even know why they're crooked in the first place. And basically everything they do makes you worse instead of making you better.
Okay.
The thing I think is so important for people to understand is this is how I explain this to people. If you look at a 2 to 2.5 year old child, they have 20 teeth, right? And they go pretty much to the back of your mouth, to the back of their mouth. So if you're going to get three more molars in there at the back, because human beings are supposed to have 32 teeth, um, that's a lot of tooth mass. Like a lower first molar is probably 12 millimeters in length, mesial distal we call it. So you multiply that by almost three. They do get slightly smaller as you go back, but you're at least 3 centimeters of forward growth that child's going to need to have in order to fit those teeth in their face, right?
Mm-hmm.
And so I think that's the key thing. The other thing I point out to people is you realistically have three problems. Your upper jaw is the main problem, right? Your upper jaw is not wide enough, it's not far enough forward, it's not far enough up because you haven't had your tongue in there. We'll probably talk about that later. So, so you've got this upper jaw that is too narrow, too far down, and too far back. There's three problems, right?
Let's repeat that. So the upper jaw is too far
It's too
back,
narrow,
too narrow.
too far down, and too far back.
Okay.
So you're going to go to an orthodontist, and if you're lucky, they're going to make it slightly wider. They're going to do some expansion, but not nearly enough. And absolutely everything else that they do makes it go down and back.
Okay.
So
Que-
you're partially correcting one of the three problems, you're making the other two worse.
question.
That doesn't sound smart to me.
Okay. When if the upper jaw is too far back, why does the lower jaw go even further back?
Well, that's kind of the mechanics of how your jaw works, right?
Okay.
It's a certain type of class two lever or whatever, where, it depends where the load is in the fulcrum and stuff. But as the upper jaw is dropping, the lower molars are going to be hitting at the back, right? And that's going to wedge it down and back.
Okay.
It all depends on, like I said, this is probably the time, I guess, to talk about the fact that, the issue is the posture, right? It's a chicken and egg problem. You've got this bad posture, and then you've got this issue, and those are related, right? So, I mean, John Mew, like the creator, the inventor of BioBlock orthotropics, kind of somehow figured this out. I mean, that guy is a genius, right? That's one of my missions in life, is to get him a Nobel Prize.
Hmm.
I think if people understood the contribution that guy has made to advancing growth modification, it'd be no brainer for him to get a Nobel Prize. So what John Mew figured out is the reason why we have these issues is because we do not have proper, what he calls, rest oral posture. So what John Mew says proper rest oral posture is supposed to be is the tongue is supposed to be on the roof of the mouth, the teeth are supposed to be in or near contact, and the mouth is supposed to be closed, and you're supposed to breathe through your nose. So if you have that habit, which is very difficult to develop if you live in Western society in the 21st century, then the pressure of your tongue in the upper jaw is going to make it wider and move it forward and hold it up, right? We all end up, because our diets are soft and we have allergies and asthma, we suck our thumb and use soothers and, whatever, all the issues there. You end up with a open mouth rest posture.
Okay.
And so when your lower jaw is constantly hanging down, just the force of that is going to cause it to kind of drift down and back, right? Your jaws are going to grow divergent.
I'm just gonna re-explain that because I'm thinking that there are some parents who, like, the technical terms might confuse them. So basically, if you don't mind me paraphrasing you,
Yeah, sure.
so what Dr. Johnson is saying is that if the upper jaw is too far back and it hasn't grown enough, the lower jaw, in order for a person to breathe, they're gonna open their mouth, right?
Yeah.
Because when the maxilla is too small, the nasal passages are too small. They can't breathe through their nose, so they breathe through their mouth. And if you open your mouth, you have to take your lower jaw and bring it down. But because your lower jaw is hinged at your temporomandibular joint, it actually rotates back. It doesn't move straight down. It moves down and back. So if your upper jaw is too far back to breathe, you've got to open your mouth. And opening your mouth pushes your lower jaw back. And it's going to be further back than your upper jaw.
Yeah, and it's interesting because
Is that it?
yeah, that's great.
Okay.
And, for me personally, as a dentist, right, orthodontics was the last thing that I was ever going to do. It just does not suit my personality at all.
Mm-hmm.
But then when I found out about BioBlock orthotropics and went to Bill's course there in LA, I came back saying, well, great, now I can never send anyone to an orthodontist again, so now I'm going to have to figure out how to do this myself, right?
Yeah.
So I read the textbook of contemporary orthodontics, which is hands down the most painful thing that I've ever done. But
Hey,
that textbook,
yeah, Rob.
yeah,
Um, so what I'm going to do is I'm going to stop the recording because the file size is getting really large,
okay,
and we're going to start. We're going to continue just with a new file,
okay,
and we'll continue about the textbook.
okay.
So I'm pressing stop right now.
Yeah, is this okay?